First, I would like to provide an update to our outbreak reporting. On Thursday, we advised that due to AHS focusing their resources on investigating high-risk outbreaks, we would need to adjust our public outbreak reporting to just continuing and acute care sites. However, in further conversations with AHS, they have confirmed that at this time, they are also able to continue to provide us with complete outbreak data for congregate living facilities such as correctional facilities and shelters. As such, these will again be listed on our outbreak list beginning today. We understand Albertans have become accustomed to having regular access to COVID information, and we appreciate everyone's patience as we make adjustments due to the Omicron situation. It's also important to remember why outbreaks are not being reported in other contexts. First of all, given the very high number of cases in the community and the fact that most cases in fully immunized people are mild and can be managed at home, outbreak activities that were used earlier in the pandemic, such as individual case tracking and contact tracing, are no longer warranted for most workplaces. Outbreak responses by public health are now focused on the highest risk settings, where there are populations at increased risk of severe outcomes, particularly acute care and seniors congregate care facilities. These are settings that would typically have outbreaks managed for other respiratory viruses, including seasonal influenza, because of the risk of severe outcomes. Other workplaces should follow the guidance that is available on BizConnect, as well as general public health recommendations, such as physical distancing and masking, to help prevent spread of COVID-19. As we look at continuing care and the impacts of the Omicron wave, we continue to emphasize the need to protect residents in these settings from multiple health risks, including the direct risk of COVID, the health risks of social isolation and disconnection, and the risks of having insufficient care providers to meet their basic care needs. These risks sometimes compete, and we have no single straightforward path to perfectly meet all these needs simultaneously. We must continue to seek balance. We have communicated details to continuing care operators today on how some of the recent changes to case management relate to residents of different care settings. For example, as was announced on January 3rd, the shortened isolation period for fully immunized cases does not apply to residents of designated supportive living facilities, hospices, or long-term care. These individuals must still isolate for 10 days if they get COVID. This is because people living in these types of facilities are at higher risk of severe illness from COVID-19. We have also recently heard concerns from some of our partners about the timing for rescinding the single-site worker order in continuing care. We are currently working through a process to ensure an orderly return to work at multiple sites for staff and employers by February 16th, 2022. This process was developed over the summer and fall of 2021 in consultation with union and labour representatives and continuing care association and operator representatives, and the approved process was communicated in December. Input from staff, residents, and families was also sought via town hall meetings and surveys as a part of the planning process. It has always been critical through this whole time to work closely with all our partners. Next week, we will again be meeting with all stakeholders to ensure they have opportunities to provide additional input on the process that is underway and the impacts of the current Omicron situation on that process. Turning to today's numbers. Over the last 24 hours, we have identified about 3,279 new cases of COVID-19 and completed about 8,995 tests. Our positivity rate for lab-confirmed cases is 38.8%. There are currently 1,089 people with COVID-19 in hospital, including 104 in the ICU. Our analytics team has been working hard with Alberta Health Services to provide a robust summary of the proportion of new hospital admissions that are due to COVID as compared to admissions because of other causes. We will provide this information on our website later this week, but for the time being, a summary is being included as a part of my weekday Twitter account updates. Our most recent data from new admissions since late last week indicates that 51% of new admissions to non-ICU spaces are due to COVID infection, and 49% are cases where the infection was not determined to be a cause of admission or where it was not possible to determine. For ICU, the percentage of new admissions due to COVID was 74%, and 26% were incidental infections or unclear. This is a different trend than what we have seen with previous variants, and it is due to the much higher transmissibility of Omicron. We're providing this data to inform planning and in alignment with other provinces' reporting. However, it is important to recognize that any COVID-positive admission has an impact on our acute care capacity. Additional care and isolation protocols need to be implemented for all COVID-positive patients to prevent the risk of transmission to other patients who are at risk for severe outcomes. It's also true that someone may be admitted to hospital for another reason, but a COVID infection can complicate their stay and their clinical outcome. The bottom line is that our acute care system remains under serious pressure, and COVID-19 continues to pose a risk of severe outcomes to many Albertans. Sadly, I must announce that 9 new deaths have been reported to Alberta Health over the last 24 hours. My sympathies go out to the family and friends who have lost someone, no matter the cause. As we continue to see, Omicron is highly transmissible, and the province is seeing a rapidly increasing number of cases. We are beginning to see our hospitalizations follow suit. On Sunday, our hospitalizations surpassed 1,000 total for the first time since October 14th. Even if we take into account the proportion of these that are admissions for other causes with an incidental COVID infection, the overall burden on the system is large and growing. This rise will continue to put pressure on our health system and the healthcare workers who take care of us. This affects all of us. Even if we do not personally become ill with COVID-19, we each continue to have regular non-COVID medical needs, and any one of us could need urgent care when we least expect it. The decisions we make now and the steps we take each day are critical to ensure the healthcare we need is available when we need it and where we need it. While we continue to learn about the Omicron variant, we have long known how to prevent infection and limit spread, and those steps are still relevant today. We know to stay home if we're feeling sick, to physically distance, reduce social contacts, to wear a mask in public, and to follow all public health measures every day. We also know how important it is to get our vaccines, not only first and second doses, but whatever additional doses we're eligible for. For a majority of the province, that would include a third dose, but given that immunocompromised individuals do not develop the same levels of immunity after vaccination, we are moving to make fourth doses available to these people. 3 doses is in fact considered to be a primary vaccine series for someone who is immunocompromised, in terms of comparing the level of protection to an average person without immunocompromising conditions. Given this, providing a 4th dose to these individuals is equivalent to a 3rd dose for others. There are approximately 80,000 immunocompromised Albertans who were eligible to get their 3rd dose in September of 2021. This means that many of them are soon reaching the 5-month mark after that 3rd dose. Both the National Advisory Committee on Immunization and the Alberta Advisory Committee on Immunization have recommended that immunocompromised individuals age 18 and over receive a 4th dose of COVID-19 vaccine. This is why, beginning this Thursday, January 20th, we're opening up booking opportunities for immunocompromised adult Albertans to receive a 4th dose of COVID-19 vaccine at least 5 months after their 3rd. 4th doses will help those who are immunocompromised to have the same level of immunity as those of us who are receiving our 3rd dose and who are not immunocompromised. This will not only help prevent some breakthrough infections that we've been seeing, but also decrease the chance that people with immune-compromising conditions could have severe outcomes from COVID-19. The list of conditions eligible for a 4th dose remain the same as those who are eligible for a 3rd dose due to a clinical diagnosis or treatment in September of 2021. You can visit alberta.ca to review that list. To be clear, fourth doses are only recommended at this time for those who have these specific medical conditions and are immunocompromised. Others who do not have these clinical conditions are not eligible for fourth doses, even if they're nearing 5 months from a third dose they may have received for travel purposes. Individuals with immunocompromising conditions may still have some risk even with this fourth dose. We must continue to work together to ensure those most vulnerable in our communities are protected. The current variant is highly infectious, and some may even be wondering if it's inevitable if they will get it. I would like to remind people of the reason that Omicron appears to be milder, which is largely because of vaccines. Vaccines dramatically reduce the risk of severe outcomes, even as we have seen some waning of protection against infection. Even with vaccines, getting sick with COVID is not a common cold. You cannot predict how far your infection will spread through others through an ongoing chain of transmission or who it will reach. Unfortunately, at some point, it will likely reach someone for whom COVID-19 is not a mild illness. So for those people, I am asking all Albertans to remain vigilant. We are all connected to each other, those we know and those we don't know, and the actions we take every day make a difference. Thank you, and I'm happy to take questions.
Thank you, Dr. Hinshaw. We'll now move to the Q&A portion of the update. Operator, can you put through the first caller, please?
Yes, hi there. I wanted to ask you about Villa Caritas and the explosion of cases that's occurred there over the past 9 days. 115 patients and 10 staff and 2 deaths. What is Alberta Health doing to try and curb this outbreak? And do you think enough is being done?
With respect to specific individual outbreaks, the supports for those outbreaks are provided by Alberta Health Services to the organizations. So unfortunately, I don't have the details of all the individual outbreaks that are happening right now. Certainly, we have seen some continuing care outbreaks with larger numbers of cases. To date, we have not seen the same impact of severe outcomes that we've seen in previous waves. However, it is early, and we continue to monitor closely. If you want specific information about how that outbreak is being managed, I would recommend talking to either the operator or Alberta Health Services may have information on the public health supports that are being provided, because this would be one of those higher risk settings for which Alberta Health Services is providing that full public health support.
Do you have a follow-up?
Yes, I do. Thank you very much. Someone on social media indicated that at Villa Caritas last week that the staff were still wearing medical masks rather than N95. Given that Dr. Theresa Tam, as well as the CDC, have recommended N95s in high-risk settings, would you concur that perhaps N95 would be a better option for those staff members?
We have updated our requirements for continuing care to indicate that when caring for an individual with a probable or confirmed case of COVID, that staff, in addition to all of the other PPE, masks do not work by themselves. So PPE does need to include other aspects such as a face shield and gown and gloves. In addition to that, KN95 or N95 mask would be considered the minimum requirement for those settings. In general, when someone is working in those settings and not providing care to an individual who is a suspect or confirmed case, they would, of course, need to always do a point of care risk assessment, as is required for all settings. But in general, the minimum requirement for those settings would be a high-quality, well-fitting medical mask. For the routine continuous masking, and again, the N95 and KN95 would be the requirement for settings when dealing with a suspect or confirmed COVID case.
Operator, can you put through the next caller, please?
Brianna Carson-Smith, Global.
Hi, Dr. Hinshaw. I wanted to ask you about hospitalizations. In Dr. Verneu's op-ed that was posted today, she said that Alberta Health Services is increasing ICU capacity. Can you tell me what that looks like, how many beds, who will staff those beds, and are there plans to ask other provinces or the military for help?
I don't have details about Alberta Health Services acute care planning, so it probably would be best to direct those specific questions to Alberta Health Services. It is clear that to date, our Omicron pressures on acute care have been greater in the non-ICU part of acute care rather than ICU. And so, of course, we're working closely with Alberta Health Services in terms of looking to what the possible trajectories might be and supporting them with data. However, again, those details of the specific acute care preparations, AHS would be best positioned to speak to. And ultimately, what all of us can do to minimize that impact on the healthcare system is to do everything we can to prevent transmission in our communities.
Brianna, do you have a follow-up?
Yeah, we're getting really close to our record high of hospitalization. So how close are we to needing redeployment, mandated overtime, or postponed surgery?
Again, I'm sorry, I'm not part of the detailed internal planning that happens within Alberta Health Services on that acute care planning. So those specific questions are probably best to direct to Alberta Health Services.
Operator, can you put through the next caller, please?
Jason Herring, Post Media.
Hi, Dr. Hinshaw. Last week, Dr. Bonnie Henry said BC has likely hit its peak in COVID-19 infections for the Omicron wave, but that hospital admissions are expected to continue to rise in the weeks ahead. Where do you believe Alberta currently is in the trajectory of our Omicron wave?
It's difficult to say. We know that other jurisdictions have seen, that have been ahead of us with Omicron, have seen their cases peak around 4 to 5 weeks from the start of the surge. When we look at our wastewater data, there are some locations where we are seeing a bit of a lowering of the wastewater concentration of the virus, but other places where we're still seeing a rise. So one thing to keep in mind is that it will be slightly different in different areas of the province, but certainly it's possible that we could be seeing a plateau or kind of reaching that peak within the next several weeks. It's always true with every wave that hospitalizations continue to rise after the peak of cases, and we have not seen that peak of acute care impact. And again, there's no definitive proof that we are currently at the peak, so we do need to continue to watch. And it's also important to remember that half of the cases that happen in a wave happen on the second side of the peak, which means that everything that we do to minimize transmission, whether it's before the peak or immediately after, still matters. And it matters until that transmission has dropped to very low levels. So our actions are important, again, whether or not we reach the peak in the next week or so. Jason, do you have a follow-up?
Yeah, thanks. I'm wondering what the current number of healthcare workers is who are off due to COVID-19 illness or exposure, and what impact it's having in patient care. And if you're unable to answer the question since it pertains to AHS acute care operations, I'm wondering if the province will commit to making Dr. Bernie Yu available at upcoming COVID-19 press conferences to field these types of questions.
It's an important question, and you're right, I don't have that information as it is more operational. I also am not part of the conversations about who attends these press conferences, but certainly that question is something that our communications team can consider. But again, unfortunately, I personally don't have the ability to make those decisions.
Operator, please put through the next caller.
Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Just following up on some of these hospitalization-related questions, I do understand that a lot of them are under AHS protocol, but we are at a point right now where the situation is actually less people in hospital, a little more in ICU than when we saw these levers pulled last time of redeployment, of postponing surgeries and procedures. Again, I understand that you don't have it on hand, but any information for Albertans on if we could see this happen? Could surgeries be postponed? Could procedures be postponed? And how are we going to staff this if we do get to that level?
Unfortunately, again, the details of staffing aren't things I could comment on, but it is absolutely clear that as the burden of acute care rises with respect to COVID admissions, that postponement of surgeries or other procedures that are non-urgent is absolutely something that is possible as the system makes space for the need to care for patients who have COVID. And again, even those who are admitted for other reasons but have a COVID infection need to have additional protocols to prevent spread of infection. So there are still impacts in terms of capacity even with those patients. So again, absolutely there could be an impact on surgeries and other procedures. The details, unfortunately, would have to be something AHS could comment on.
Lauren, do you have a follow-up?
I do, thank you. We are now in the fifth wave of this. We have hit record hospitalizations during the fourth wave as well. Can you explain to me, how did we get to this point again? And do you take any responsibility for what led us here?
I think that one of the major factors is the high transmissibility of the Omicron variant. The question about the progression of the wave, certainly in every wave we've had, we've seen a series of points in time where the situation is assessed. I have provided recommendations along the way. And so the decisions about managing cases, managing the wave, I can't speak on behalf of elected officials about decisions. All I can say is that Omicron is more challenging than anything we have dealt with before, that it is more transmissible, it does cause more breakthrough infections, and that the decisions about managing that pressure, again, are not mine to make.
Operator, please put through the next caller.
Dylan Short, Post Media.
Hi, Dr. Hinshaw. Looking at third dose booster numbers, it looks like Alberta is lagging a little behind other major population provinces. We also saw this with first and second dose uptake. I was just wondering, why do you think Albertans may be a little bit slower to get their vaccinations in other parts of the country?
It's difficult to speculate. Certainly when polling has been done looking at the intentions of Albertans to get vaccine, there has been sometimes a lower percentage in Alberta than other provinces. What we've seen historically is that although initially there's been a slower uptake, there has been an increase over time. So I would encourage those, Albertans may be wondering if they need a third dose or wondering if Omicron is mild. Is it really important to get that third dose? And I would say to those who are contemplating or wondering, first of all, again, the reason Omicron is mild is because we have high vaccine coverage. And so the fact that someone who gets a breakthrough infection doesn't end up as often needing hospital care is exactly because the vaccines are providing that severe outcome protection. And that third doses not only improve that severe outcome protection, they also help reduce the risk of infection, which means that people who get a third dose are contributing to that protection for their community and minimizing the chance of onward spread. So it does remain very important, and I would encourage Albertans who don't have that protection for themselves and their community to take the first available opportunity to get it.
Dylan, do you have a follow-up?
Yeah, I know that there's been a lot of messaging and a lot of talks, as well as making vaccines available at pharmacies and at clinics and in different community places. But in earlier waves, we saw a number of other initiatives, whether that was the lottery or it was payments to encourage people to go get those doses. I guess are any of those previous incentives or other incentives that we haven't looked at before? Are any of those being discussed at this time as whether to bring them in to encourage more third dose uptake?
It's important to consider how we can encourage that third dose uptake. Certainly the incentives that were used earlier, I'm not aware that they're going to be brought back, but I do think it's important that we look at all the ways that we can encourage Albertans to get the protection of that third dose and what might be feasible at this time.
We have time for 2 more questions. Operator, can you put through the next caller, please?
Matt Woodman, CTV.
Hi, Dr. Hinshaw. We're hearing from healthcare workers that non-ICU space is becoming tough to manage just based on the sheer number of patients and staff shortages. What is your message to healthcare staff, and what should they be prepared for in the coming weeks?
My first message to healthcare staff is that I recognize that this is just the latest onslaught in what has been a very, very long series of waves, and that I can only imagine how tired they are, and that this current wave is just adding to an already significant level of fatigue. So I would say how much their efforts are appreciated, but also that that appreciation can only go so far when they are day in and day out having to manage this pressure. I think that the coming weeks will involve increasing burdens on our acute care, because we know that it does take several weeks after a peak of cases to see the peak of impact in our acute care system. So whether it's ICU beds or non-ICU beds, I would say to those who are working in the system on the front line, thank you. And unfortunately, we do need to prepare for this to get worse before it gets better.
Matt, do you have a follow-up?
I do. Do you foresee a day when the province is encouraging regular Albertans, people who don't have immunocompromised conditions, do you foresee a day when you're encouraging them to get a fourth dose?
It's difficult to say. We've seen some other countries make that decision, but we haven't seen data that would indicate that that fourth dose is necessary at this point in time for average Albertans. As we have always done, we will continue to closely monitor the data and determine what is recommended with respect to any additional doses. But at the moment, we are seeing, again, that severe outcome protection is significant even with 2 doses. It's better with 3. And while there can be some breakthrough infection, that severe outcome protection is one of the most important things that vaccines provide. So again, we'll continue to monitor the data. And as evidence emerges, we will use that to incorporate into our program.
Operator, please put through our last caller.
David Staples, Edmonton Journal.
Hi, Dr. Hinshaw. Thank you for taking my call. You talked about the new numbers on new patients coming into the hospital, and it sounded like about a half of them are there because of COVID and half with COVID. What is the significance of those numbers? How will that play out in the system? Why do we need to know that kind of thing?
We know that in past waves, when we've looked back, about 90% or more of the cases that we have been documenting with admissions are directly due to that COVID infection, and this is different. So we need to document this now because Omicron is different, and because it's important for us to be looking at our system impacts, looking ahead. I want to be clear that that 50% is only for those who are not going into ICU. Where it is an ICU admission, the number is much higher. So we're looking at something closer to 70-75%. So again, it's to be able to provide people with an understanding of what the direct and indirect burdens are, and also for us to be able to plan what the impact could be for, again, the direct COVID-caused hospitalizations. Because Omicron is very different from other virus variants that we have dealt with in the past, we do need this kind of data to help us adjust our forward projections, and of course, feel that it's important to make it available to the public as well.
David, do you have a follow-up?
Yeah, for example, if Omicron continues to take over from Delta, and there's fewer and fewer Delta cases, more and more Omicron cases, would that give you, and if the Omicron cases, for instance, are less likely to be because of COVID in the hospital or because of COVID in ICU, would that then give you an idea that we're going to have, even though we might have higher case counts, we might have fewer people in hospital or in ICU if Omicron takes over more and more from Delta?
We certainly are seeing Omicron as the vast majority of our cases right now. So looking at greater than 95% of the cases that are screened are Omicron. So right now we are in that situation in terms of Omicron being the majority of the new cases. And certainly, again, for those projections, it does matter the anticipated impact of where those cases end up. And it does seem that with Omicron, we are seeing that lower individual severe risk. Although I want to emphasize that at a population level, there is still a significant burden on the healthcare system, and we should not take this lightly. But we do need to understand those specific ratios so that it can help us plan for and prepare for what we think that acute care system impact will be.
Thank you, everyone. That concludes today's COVID-19 update. We will be available for the next one later in the week. Thank you. Have a good day.